Well, hello everyone. My name's Anne Marie Rafferty. I have the great pleasure of being Professor of Health Policy at King's College London in the Faculty of Nursing, Midwifery and Palliative Care. I'm also President of the Royal College of Nursing. And it's my great pleasure to be speaking with Professor Louise Rose, also from our faculty today, about her involvement in the current COVID-19 pandemic. So welcome to you, Louise. I just wondered if you could tell us a little bit about your background and your role at King's, please.
Sure, absolutely. Thank you. And hello, everybody. So my current role at King's is as a Professor of Critical Care Nursing. And I joined King's full-time last year, moving from the University of Toronto, where I was an assistant and then associate professor for over 12 years. Before that, I was in Melbourne in Australia. I did my master's and my PhD there, and I had a long career within the intensive care units, both paediatric and adult, in Australia, New Zealand, and some time in the UK and then in Canada.
Wow, that's quite an impressive track record, Louise, and perhaps perfectly suits you for your role in the current pandemic. Can you just tell us a little bit about what that role has actually entailed, please?
Sure, absolutely. So during the COVID-19 pandemic, I have co-founded Lifelines with my colleague, Dr. John Meyer. So Lifelines is a project that we came up with to provide a solution for the inability of families to visit hospitals, and particularly in intensive care units. So we established this project at around the mid-March time, and have since then enabled the delivery of a virtual visiting solution on a 4G-enabled tablet, which we've delivered to over 150 hospitals across the 4 nations of the UK.
Well, that's a seriously impressive endeavour, and I'm sure it's one that's had some ups and downs. But where did the idea of Lifelines originate?
So Joel and I came to the idea of Lifeline separately and very much then joined together. We'd never worked together before. So on the Sunday morning of the 15th, I was reading the papers talking about the Italian families and how their loved ones were dying in intensive care units, and they weren't able to see them at all, and thinking how tragic and terrible that would be. And being aware that the COVID surge was heading towards London rapidly, and of course then across the rest of the country. And at the same time, they had just admitted their 5th ventilated patient in the intensive care unit at St Thomas's with COVID. And Joel had been tasked with the job of finding a virtual visiting solution that would work across, large numbers of ventilated patients, with them rapidly expanding their ICU bed number from 100 to 200 to potentially 300 patients, and needing to find a solution to help families and patients connect together. So that's how we started, and we progressed rapidly. That evening we had a conversation with Michelle Paquette, who is the CEO of A Touch Away. So I had worked with A Touch Away and still work with A Touch Away in Canada in a research setting, and it's a platform that is normally used to support people living at home with chronic conditions, helping them self-manage and connect to their clinical teams. So I thought that we could use this platform, turn it around a little bit, and use it to connect clinical teams to family members at home and enable this support. So we had a conversation that evening with Michelle, and then they did some programming work, and we did some beta testing at St Thomas's, and then we were able to launch across the country with some very generous support from both British Telecom and Google, who provide us with tablets that are enabled with 4G data and a mobile device management system that has a platform and enables us to be able to manage our tablets remotely, and also through very generous donations from the Gatsby Foundation and True Colours Trust. that enabled us to support 1,000 tablets across the country.
That sounds fantastic and all happened very, very quickly. What would you say has been the impact of Lifelines?
So, as I said, we've been now enabled to deliver over 1,000 tablets to 150 hospitals across the 4 nations of the UK. And so we're also able to log our call records. So now we've demonstrated over 16,000 calls connected across the UK and over 2,500 hours of time with families and patients connected and the clinical teams. We've also had many, many positive stories, both returned to us clinically and through our Twitter feeds. We've had a marriage proposal, we've had birthday parties, we've had people connected from across the world. And of course, we've also had some sad moments, and many of our calls have also enabled family members to connect with their loved one at end of life and say their goodbyes.
It sounds as if it's been one of the silver linings of this pandemic and a positive force for good. What are your plans for the future in this regard, Louise?
Lifeline's project is going to continue. So obviously things are starting to change in the intensive care unit in terms of the numbers of patients, although family visiting is still heavily restricted. So through another very generous donation from Google, we now have more funds to continue. And what we're planning to do with this is not only enable our families to remain connected within the ICU, but also to remain connected as patients recover, travel out to the wards, and build into the tablets a recovery pathway and rehabilitation tools that the patient can then take with them, not only to connect with their families, but then take with them and the clinical team out back home to continue with their rehab and recovery and support that survivorship journey.
It sounds as if that's something that should become part of the mainstream, and I know it obviously has to be researched and evaluated in the meantime, but it's fantastic to hear of all the great work that you've been pioneering, and thank goodness for that early connection, that synaptic moment when you made that link between the long-term care of touchaways and Lifelines now. It's been a great pleasure speaking with you, Louise, on this important topic, and wish you and your colleagues all the very best for the future, for your work, and indeed for Lifelines.
Thank you very much. It's been a pleasure to speak with you today.
Thanks, Louise.